We've been using a Depuy Synthes.
2.4 distal radius system. Okay, so that is in 2.4 locking screw and, most importantly, 2.4 Cortex screw. Okay, not 2.7, 2.4. Okay.
Their system is really easy, understandable. Recently did this training with us to inform us that for our distal radius system, they actually recommend for us to use all 2.4 screws because apparently if you use 2.7 screws, you are more likely to cause tendon irritation, and they say that the 2.4 screws are enough to be used for that part, and this way you don't have to get confused about what drill to use.
Now for this system, to make it simple, one drill, 1.8 mils, okay? You have VA available, so you have your VA like the elbow system, again 2.4. You have your nominal and you have your towers, okay? And you have a T8 star drive. So from your point of view, it's easy because you have one drill. It just makes the whole system so much easier. Okay. Now what you have,
We have torque for locking, isn't it? The only other screwdriver is the Cortex screwdriver. Because there's another one there, isn't it? This one. This one is not torque limiting, and then
that's not torque limiting. So if they want, what will happen is they want to sometimes use the cortical screw, which is probably why they want the 2.7, but they don't need to. So you see how that's on there? Because they want to compress it to the bone more, which is why they need a cortical screw. And they think that they can compress it better with a 2.7, but that's not true. This will still compress it just as good.
No, we're talking about the screwdriver.
So if you use the 2.4mm screws, then all we need is the 1.8 drill, and that's it. But apparently, other systems need to use the 2.7 shaft screw, and that's why most surgeons are so used to using a 2.7 screw for the shaft. But apparently, in the Depuy Synthes distal radius system, it's not necessarily the case. You can safely use a 2.4mm screw for the shaft.
What they will do on your sets is have different sizes. So you have narrow, standard, wide. Okay. That's the main difference between them. All right. So they will probably use the trial. They will tell you, right, I need to have a standard. When it comes to distal radius, the 2-column plate will fix 94% of all distal radius fractures. Okay. So this is always your go-to. We have like things like a volar rim plate, so this one will sit past the watershed line and you'll be able to do really distal fractures. With the VA, if you get it to sit right, it will even be able to fire into the radial styloid. So you don't need a radial styloid plate, and with the 30-degree cone, you can fire a screw in there and you can hold that if there's a fracture. Okay? And this is what's good about this particular plate and having VA in it. The main thing to remember, and when they ask for a 2.7 is, we have a 2.4 Cortex. That is what's on this set. That's what it's designed for. And try to get them into the habit of accepting to use the 2.4. The drills on the set, there's a calibration. You see like a little marker. So when you use the tower, when you put it in, you can actually see and measure.
Oh yeah, we don't have a drill bit on the set. We use disposable.
Yeah,
drill.
your sterile drills don't have that.
Yeah.
So you have to actually
Use the measure.
Yeah. So it just makes it easier. So when you put this into the plate, so that's screwed in. So if you've got a couple of towels, they can drill, quickly measure, and you can open up one or two to the same size screw. The point of this system is it's low profile, and you get no tendon irritation. So whenever they're doing distal radius, with some of the other systems, when you've got 2.7 in the shaft, they just stick up. You just get the tendons rub all the time, just rubbing on that.